Now, from the Signature Bank Studios. This is Chicago's Morning Answer with Dan Proft on AM 560. The Answer.
Top of the morning, Dan Proft here. I'll give him this. It was a game effort. I'm talking about Texas Congresswoman Lloyd Doggett. He's a neo-Marxist. In a committee hearing with HHS Secretary RFK Jr. trying to flip the script when it comes to Medicare and Medicaid fraud. It's RFK Jr.'s fault, you see.
Fired everybody in my agency except for 6 people who were involved in program integrity.
In fact, under your leadership, you have suspended the very people at CMS who are responsible for overseeing any fraud in the program.
But we've done more to combat fraud than any administration.
If you want to filibuster, go to the Senate. But would you please try to answer my question, sir? Have there been any new complaints against these 850 brokers?
As I said, I'm happy to talk to get my staff to contact.
I'm not asking if you're happy to talk. I just want to know the answer to my question. Have there been any new complaints of fraud against these people?
I don't know why those people were reinstated. For as far as I'm concerned, it may be because of a lawsuit. I have to check on that.
Well, I wish
I can
would.
guarantee you there is no administration.
Reclaiming my time, sir, as it runs out. It is very troubling that the only fraud that Chairman Smith referred to as a smoking gun to deny affordable health care credits, put the blame on the mother that was trying to protect the sick child, that nothing was done about that, and the Secretary still doesn't know much of anything about it. As far as fraud, Paul Wazak is one who had $10 million of wages that he kept, some of to buy a $2 million yacht. His mother contributed to the Trump campaign.
Yeah, I mean, all of this anecdotal misdirection for the purpose of suggesting that COVID fraud, Obamacare fraud, transfer payments fraud that we're talking about and is being aggressively pursued by the fraud task force that J.D. Vance is heading up. You've seen Dr. Oz circumnavigating the country, talking about different industries in different regions that they're looking at because of, all the telltale signs, concentration and, one-room office spaces where mail is piling up, things we see from the independent journalists like Nick Shirley and many others. So now, just back to our discussion from last hour with Jack Butler, we're just at the outset of this, but it's clear that this is concerning politically to these neo-Marxists, so they're trying to muddy the waters and suggest the Trump administration somehow is suborning the fraud that they're in the process of unearthing and addressing. More on this topic and other matters related to MAHA. Steve Kirsch joins us, tech entrepreneur and philanthropist, executive director of the Vaccine Safety Research Foundation, and founder of the COVID-19 Early Treatment Fund. Steve, thanks for joining us. Appreciate it.
Sure, good to be here, Dan.
So, just your perspective, not just on RFK Jr., but on the larger issue that we're just, as I said, at the beginning of trying to get our arms around, the fraud that is replete through all things that are underwritten by Medicare and Medicaid, coming off of do we even have a handle on this, the hundreds of billions, maybe trillions of dollars of fraud during the drop shipping of cash everywhere under COVID?
Well, there's no question there's a lot of fraud, a lot of Medicare fraud, and I think the question is what to do about it. And I remember reading much earlier about a program where they would offer people rewards that you would get like 40% of any Medicare fraud that you uncovered. And they did that right after they released the Medicare claims data. And so I've been waiting for that program to actually happen, because once that happens, then people throughout the United States maybe who don't have a job, will be incentivized to find Medicare fraud, and people will be incentivized to report in the Medicare fraud that they may know about. I mean, there's huge incentive, and if you're recovering 40% of that fraud, there's huge incentive for you to report that to the government, because you can personally and legally recover 40% of that. So
I think Besant announced that last week, and I think the number is 30%. But obviously, this needs sort of consistent publicizing in order that people are aware of this, and hopefully with all the scrutiny and the stories about egregious examples of such fraud, that it'll get a little bit of notoriety, and then you can, as you say, activate people who may know something but aren't motivated unless they're financially incentivized to act.
Yeah, I mean, if you're out to uncover fraud, I can't think of any more effective method than this, because there's so much fraud and some of it is so well hidden that unless you have a lot of people searching for it, you're not going to find it. So this gets you essentially free labor, and you don't recover all the fraud, but recovering some of the fraud, whether it's 60% or 70%, is a lot better than recovering none of the fraud.
One of the things that we talked a lot about with respect to Trump's second term, reckonings, lawfare reckonings. One of the reckonings was COVID and all the policies, the ham-handed and authoritarian policies that were instituted during COVID, in addition to all of the money that was flying around. And I wonder, a year plus in now, where you think that is in terms of improving the quality of these public health agencies and delivering something approximating a reckoning, whether it's just in terms of improvement of their transparency and functioning and integrity, or which I don't really think has happened, but you can opine on this, holding people who were bad actors accountable.
Yeah, I agree. I don't think very much of that has happened at all. The only place that is honest about this is in Florida with Joe Ladapo, and he's been outspoken since the very beginning on this. And I've known Joe for a long time, well before he was the Surgeon General.
Surgeon General, yeah, back when he was at UCLA, yeah. Mm-hmm.
Yeah. And so I remember being on a panel with him, and I asked him, "So, did you get the vaccine?" And he said, "Well, it's a complicated story." And so he was aware early on that the vaccines were not what they were represented to be. And as far as we can tell, the vaccines appeared to be beneficial because the people who lined up to get the vaccine are typically the healthiest people in the country, and so they'll come down with COVID far less. In fact, there are many studies. There's a paper called the Mirror of Erised, which is desire spelled backwards. It's a Harry Potter term. And that it basically in the Mirror of Erised, you see whatever you desire. And so this paper talked about there's a 5 times difference between the mortality of the vaccinated versus the unvaccinated, where the unvaccinated typically die at 5 times, or can die at up to 5 times, or even more in some countries like Hong Kong, than the vaccinated. And so when you have a disparity like that that's 5x, that allows you to claim that you have a vaccine with an 80% efficacy against death when in fact it does nothing. And so these are the kinds of things where people focus on, look, the vaccinated are dying at 5 times lower rate for the same age. But they never mention or even look at the fact that Well, yeah, but that was true during non-COVID too, and so that ratio was the same during COVID versus non-COVID. So it's not showing you that people were protected, and so you have to look at things like the CMS data, the U.S. nursing homes. You look at and you calculate the case fatality rate when they roll out the vaccines during the alpha wave of COVID, and you find that the case fatality rate basically went up after they rolled out the shot. So it certainly wasn't keeping people from dying. And the other thing that they could claim is, well, yeah, but it reduced cases. But then if you look at places like South Korea, they rolled out the shots in South Korea, and then suddenly about a month or two later, so you can't say that the vaccine wore off or the vaccine didn't have enough time to take effect. South Korea had its base level of all-cause mortality, it nearly doubled. It nearly doubled the base fatality, the base mortality rate, nearly doubled in South Korea after they rolled out the shot. So how can you have the highest cases and deaths in the world on a vaccine which is claimed to be reducing deaths by 80% or 90%? The real life examples don't make any sense, and Israel is another example of that, where their alpha wave was relatively standard, but Delta and Omicron infections were 10 times higher than their alpha infections. And so even within country, you're seeing these massive increases in cases and deaths.
Well, yeah, I mean, so, and maybe I've been remiss, everybody moves on and you sort of don't go back and live up to the commitments you made in terms of like, we're going to do studies, we're going to be monitoring this, we're going to get a handle on all of the VAERS reporting and provide some synthesis of that for the American people to consume. Now that we're a few years removed, you can start looking at patients who took the vax. Took, one shot, 2 shots, 3 shots, 5 shots. Is there a difference in health outcomes or adverse outcomes, incidence of adverse outcomes among these different cohorts? I mean, have I just missed it and that research has been done, or all the research that was to be done to do sort of after action assessments of everything we did is pretty non-existent?
Well, the problem is data transparency, and they're not releasing the data in any country about what's happened, so independent researchers can analyze it. The only country in the world that's released the record level data for what happened is in the Czech Republic. But there was a paper in France recently that came out and said, well, COVID infection or the COVID vaccine reduced your all-cause mortality by 25%. Well, come on. So again, this is the healthy vaccine effect operating, and there's a great paper by Obel that looked at the Danish registry data, and what they did is they matched up people one to one, and they discovered that they couldn't overcome this, what's called the healthy vaccine effect. And so they said, well, we really don't know what's going on, and the only way we're going to tell is through randomized trials, because this healthy vaccine effect is so large that we can't tell you whether the vaccine was successful or not. And recently, Vinay Prasad wrote a memo at the FDA, which was disclosed by the Washington Post. And it was, so it's out there, it's public, everyone can see it. And in that memo, he says, well, at least 10 children were determined to be killed by the vaccine. And so first of all, that should be a disaster. And I don't think anybody on the panel, on that Senate panel, talked about the 10 kids that were killed by the vaccine, because what I heard is that 9 people died from raw milk, and therefore Secretary Kennedy should take raw milk off the market. And Secretary Kennedy says it's not regulated by the FDA; it's regulated by the states, so he can't do that. But they considered nine deaths in the country to constitute grounds for taking raw milk off the market. But 10 kids being killed by the COVID vaccine, there was no problem with that.
Well, what's your assessment of? Trump just named this new director of the CDC, Dr. Erica Schwartz from Brown University. She's a graduate of Brown University Medical School. I think she served in the military as well. But then the combination of her now and those who've been around longer, like Makari and Jay Bhattacharya and RFK Jr. I mean, these, especially Makari and Jay Bhattacharya, were some of the leading lights in the medical profession. The Barrington Declaration and all of this, and this is all just sort of dissipated to my level of understanding. And we want assessments of what the impacts were, and I would think that people who did take 1, 2, 3, 5, 7 shots would want some understanding of what the public health community understands about the long-term impact.
Right, and that is a taboo topic because apparently it's not popular for midterms, so they're being told not to talk about it. When Kennedy was on Rogan, he didn't mention the word vaccine, and so they're basically being constrained because they don't want to lose their jobs. And so we're not seeing any accountability here. And Trump still views the COVID vaccines as one of his greatest accomplishments. So if it seems counter that he would allow them to take his greatest accomplishment off the market because that would be a black mark on his record. So I don't think it's going to happen during his term. And it's not because Secretary Kennedy doesn't want to take the vaccines on the market. It's because the president doesn't want to have that happen. So
well, that's a problem. Yeah, that's a problem. I'm surprised too. Like Rand Paul, Rand Paul, who was out for blood when it came to Tony Fauci, but he's apparently moved on as well. I mean, we talk about the deep state actors, and we know some of the things that Francis Collins and Tony Fauci said were untrue, and spectacularly so. Some were wrong, some were untrue, and seemingly knowingly untrue. Even Redfield has essentially conceded that, or he did, sort of during the campaign, and he's sort of gone away too. But it's just like, it just seems like everybody is moving on, and whatever happens, and it'll just be people sharing anecdotes, and it's just still a cloudy picture.
And there's still no accountability. Like in the Pfizer trial, if you pour through the clinical trial, these supposed to be randomized clinical trial documents, you find that there is a 5 times greater exclusions if you were in the vaccinated arm versus in the placebo arm. And this is in protocol exclusions. And so those should be exactly matched or close to exactly matched if it's truly randomized. And there was a 5 times difference, and it was the difference between 60 versus 300. And if you do the statistics on that, you find what's called a Z-score of about 19, which means that it's 19 standard deviations off of random, which would be 50-50. And that means that the exclusions were not random at all. They couldn't be. They couldn't possibly be random.
So the quote unquote randomized trials were cooked, is what you're saying.
It certainly seems that way, and it's interesting that the Senate panel isn't asking any questions at all about the scientific integrity of these trials. And of course, there's even more troubling is the story of Maddie Daguerre, who was in the the 12 to 15-year-old Pfizer trial, she was paralyzed less than 24 hours after her second Pfizer shot. And so the FDA actually, I got the FDA. I talked to Janet Woodcock of the FDA, and she talked to Peter Marks, and Peter Marks then talked to the drug company, and the drug company said, well, her injury wasn't vaccine-related, which might be plausible, but the problem is that the drug company actually never talked to Maddie DeGarry. So how can the drug company say that it wasn't related to the drug if they didn't examine the patient? No medical records.
Yeah, right. Well, and maybe part of this, too, is, the Trump administration has other interests in terms of relationships with the drug companies on drug pricing, and Trump has got some concessions there, and Trump RX and all these things. And so now that we're allied on some things, we don't want to make anybody uncomfortable on other things.
Well, it's very uncomfortable if the vaccines have killed more people than they've saved. And we rolled out a program that basically did the opposite of what was claimed. And not only did we roll it out, but we made it mandatory. And we saw some, really troubling statistics, such as in Q3 of 2021, when more the working age people were basically told, hey, if you don't get vaccinated, then you're not going to have a job.
Yeah.
At insurance companies, we're seeing record high. I mean, this is like doubling of mortality in Q3 of 2021 when these shots were mandated. So, and people aren't talking about it. The insurance company executives have said, well, we don't know what caused it, but it wasn't COVID. And whenever they say we don't know what caused it,
but they can exclude something they want to exclude, yeah.
Yeah, you can pretty much know that that's a code word for the vaccine. This is just like in 1934, there was this outbreak of polio-like disease in Los Angeles County General Hospital. And to this day, it's unknown as to what caused it. And when you actually do the research, you find that they were given this vaccine for polio to the hospital workers. But again, you can't blame a vaccine, and so therefore the cause is unknown because you're not allowed to blame the killer.
Very frustrating. I guess, just hiring back the people in the federal government that were fired, and police and elsewhere, I guess that suffices, and life is for the living, and we move on. I don't know. Steve Kirsch, tech entrepreneur and philanthropist, executive director of the Vaccine Safety Research Foundation, and founder of the COVID-19 Early Treatment Fund. You can read his writings at KirschSubstack.com. Steve Kirsch, thanks for joining us again. Appreciate it.
Yeah, thanks, Dan. And if I have a final word is that there are about a dozen studies comparing the fully vaccinated with the fully unvaccinated, and this is in the peer-reviewed literature, and in every single case, the fully unvaccinated are always healthier in every single study than the fully vaccinated. And so when you're talking about the chronic health in America problem, people are ignoring this, that in every single study done where they compare the groups, the fully unvaccinated kids are far healthier on every single metric.
Steve Kirsch, thanks so much. Appreciate it. Yep. And Steve joined us on the alphawealthgroup.com answer line.
It's like a hot, steaming cup of information to start your day. It's Chicago's Morning Answer on AM 560. The Answer.
Each morning, the newsmakers and the newsbreakers shaping today's conversation are heard on the alphawealthgroup.com answer line on Chicago's Morning Answer. When you need answers